morning and welcome back. In just 5 years, Peoria has seen 6 women's health specialists leave their practices. 4, some have retired and others have just taken their talents elsewhere. In my special health report, local physicians explain how it's affecting them and new patients looking for a doctor. Doctors recommend women visit a gynecologist by age 21 for what's called a well woman exam. But in the heart of Illinois, an obstetrician and gynecologist, or OBGYN, shortage makes that more difficult. 6 physicians have left their practices in recent years for a variety of reasons, leaving hundreds of women to seek new doctors. Dr. Michelle Corey at the Corey Center for Gynecology says this changed the landscape in women's health dramatically.
I've had to add additional staff, so I hired another physician last year, and we have 2 nurse practitioners and 2 physician's assistants. So we've had to grow to accommodate.
And it's not just Peoria's losses creating the problem.
We have several hospitals that have stopped delivering babies, Kewanee, Princeton, and Geneseo as an example. And if you look at the outlying hospitals that might have taken care of a lot of the lower risk pregnancies, they've lost physicians also. And so the patients who live within 30 or 45 minutes of Peoria are putting an additional strain.
It's now a nationwide issue. A study done by Doximity found the top 10 areas at the highest risk for an OBGYN shortage. That report says young retirement waves are a major factor. The average OBGYN retires at age 59 compared to the average working American at 64.
It's workload and it's work-life balance, I think. But one of the pressures in obstetrics is the unpredictability of when you're going to be up at night.
Dr. Corey says patients with an acute problem will be seen within 24 hours in her practice, while new patients will likely have to schedule a few weeks out. And that wait is on the low end of the scale. Dr. Michael Leonardi says he's seen offices schedule out 6 months to a year for new patients. This has offices relying on nurse practitioners now more than ever, according to both doctors.
Between 100 and 150 patients a day will come through the office. Routine well woman exams, patients just want to come in and have their breast, pap, and pelvic exam. They're very willing and happy to see a nurse practitioner to get their needs met in a timely fashion.
So how do we fix the shortage? Dr. Leonardi says they can start by talking to med students.
And we've got to find a way that people can practice this amazing, miraculous thing we do, and at the same time have time for themselves and their families and that work-life balance.
And Dr. Corey believes the first step is communication across the specialty so doctors don't get burned out. Both doctors stress women should establish a women's health doctor before an emergency. And Dr. Leonardi says having a doctor in line 3 months before pregnant is essential for prenatal care.